Welcome to RAAONLINE. I am Dr. Sudakshina, Professor of Anatomy. Today we are going to discuss a case, and the case goes like this. A 60-year-old female patient with a 27-year-old history of smoking complained of an aphthous lesion under the tongue. On intraoral examination, it showed ulcerated exophytic lesion with hardened edges on ventral surface of the tongue with no pain. The upper deep cervical lymph nodes were palpable and they were hard bilaterally. Give the condition and give the part, muscles, movements, blood supply, nerve supply, lymphatic drainage and applied aspect of the organ concerned. Now this is a very important essay question in the university, and tongue is anatomy of tongue. Basically this condition is actually of a squamous cell carcinoma of the tongue, which is quite common. So this question is repeatedly given as a case-based early clinical exposure question in most of the universities around the world. So coming to the condition as such, to tell about the tongue, the anatomy of tongue, we have to first know the tongue is a mobile and a muscular organ. So basically it is a mobile and a muscular organ. And what is the functions of the tongue? So it has the main functions of the tongue is deglutition. So we have something like a deglutition function. Definitely it is very important for speech. So speech also it is very important. It is also going to help us in mastication movement. So definitely for chewing the food and everything and mixing the food with the salivary secretion, tongue is a very important organ. Now coming to the external features of the tongue actually has, if you see this diagram, it is divided into two parts. You can see over here, we have a foramen cecum in the center of the tongue. And then we have a sulcus, which is called the V-shaped sulcus, which is called the sulcus terminalis, which divides the tongue into anterior 2/3 of the tongue and posterior 1/3 of the tongue. So anterior 2/3 and posterior 1/3 of the tongue. So anterior 2/3 of the tongue is also called the oral part of the tongue, which is very important, and this is the place where the taste sensations are maximally picked up. So its very important function is definitely another very important function of the tongue is the taste sensation. Now coming to the posterior 1/3 of the tongue, it is mainly, we can see this orange color structures over here. These are not any papillae or not going to take up the taste sensation. They are mainly the lingual tonsil. So that is important because the posterior 1/3 of the tongue or the pharyngeal part of the tongue, that is also called the pharyngeal part of the tongue. So this is the pharyngeal part of the tongue. So that is going to have lot of lymphoid follicles. Now coming to the bluish area, which you can see over here, shaded bluish area, that is actually the posterior most part of the tongue, and that will be connected to the epiglottis. So you can see over here, this is the epiglottis. So it is connected to the epiglottis by these folds, which is the median epiglottic fold and the lateral epiglottic fold. So this LGE is the lateral epiglottic fold, whereas MGE is the medial epiglottic fold. And there is a space between the posterior most part of the tongue and the epiglottis, and that space is called the vallecula. So now we are having this part, whatever we are seeing in the oral cavity, the part of the tongue when the tongue is projected or whenever we open the oral cavity, the part of the tongue which is seen is the dorsal surface of the tongue. Now very important to understand that this is the dorsal surface, which is actually more or less convex and it is very rough. Okay, whereas if we see the floor of the mouth or when the tongue is lifted up, we see the inferior surface of the tongue. That I will come in the next slide. So when we see the dorsal surface of the tongue, I told you that we have divided the tongue into anterior 2/3 of the tongue, which is the oral part of the tongue, and the posterior 1/3 of the tongue, which is actually the pharyngeal part of the tongue, and the posterior most part of the tongue, which is the blue color, and that is actually getting attached to the epiglottis.